Good morning, everyone, and thank you for joining us today as we honor National Black HIV, AIDS, and Awareness Day. My name is Erin Whalen. I use she, her pronouns, and I'm the Executive Director of SMILE. SMILE's work supporting LGBTQ+ youth began in 1984, the same year that researchers identified HIV as the underlying cause of AIDS. Over the last 4 decades, our work has evolved to meet the changing needs of the young people we serve. We've seen immense steps forward towards LGBTQ+ inclusion, yet despite this progress, many of the same barriers and obstacles still exist for young, queer, trans, and especially people of color. 2 of those continued challenges are housing justice and access to health care. Youth aged 13 to 24 accounted for approximately 20% of new HIV diagnosis in 2020. And of those newly diagnosed, 4 in 5 were Black and 4 in 5 were men who have sex with men. In 2021, nearly 40% of the youth experiencing homelessness in D.C. identified as LGBTQ+. It's at this intersection that SMILE and the D.C. Department of Health came together to open an innovative housing program last spring. The program co-created by SMILE and DOH is a transitional housing program that supports up to 8 residents at any given time. Designed to support men who have sex with men ages 25 to 35. Residents are provided with co-case management, help referrals, and PrEP coordinated with both of these organizations. Beyond the basics, this program highlights the importance of creating an environment that welcomes each of our residents and gives them a space where they are welcomed just as they are, time to build a financial foundation, and resources that promote healthy sexual lives. This partnership combines SMILE's expertise supporting LGBTQ+ populations through housing with the Department of Health resources, demonstrating the importance of government and community organizations working together towards a shared goal of improving the lives of the populations we serve. The issues facing individuals living with HIV and AIDS are complex and require us all to address the intersectionality of these challenges. It is our responsibility to collaborate and help create access and continuity of care. We are proud to be partners in raising awareness, reducing the stigma, and working to see a world without HIV and AIDS. It is now my pleasure to invite Dr. Sharon Lewis, the Interim Director of DC Health.
Good morning, and thank you, Ms. Whalen, for your warm welcome. I'm excited to be here. And to highlight how partnerships with community-based organizations such as SMILE help us at DC Health provide invaluable services and resources for district residents. We're also here today to talk about the release of the 2022 HIV, sexually transmitted infections, hepatitis, and tuberculosis surveillance report. This annual report is an integral component of our Mayor Muriel Bowser's vision and DC Health's work to end the HIV epidemic in the district. In December 2020, Mayor Bowser announced the release of the district's updated Ending the HIV Epidemic Plan and new community platform, DCEndsHIV.org. Since then, DC Health has worked hard to achieve the goals outlined in this plan, which include for 95% of people living with HIV to know their status, 95% of people living with HIV who know their status to be on an antiretroviral therapy, and 95% of people living with HIV on antiretroviral therapy to achieve viral suppression. We strive not only to end the HIV epidemic, but to fight for overall better health outcomes for all communities impacted by health disparities. I am happy to also be joined today by a few of our federal partners. Harold J. Phillips, Director of the White House Office of the National AIDS Policy. Dr. Dimitri C. Dakalakis, Deputy Coordinator of the White House National Mpox Response currently deployed from his role as the director of the Division of HIV/AIDS Prevention for Centers for Disease Control, CDC, and Rita Harcrow, director of the Office of HIV/AIDS Housing for the U.S. Department of Housing and Urban Development, HUD. They will bring greetings on behalf of the federal government and highlight the importance of partnerships to end HIV/AIDS epidemic, and not just in the district, but across the nation. Following our federal partners, we will have Clover Barnes, Senior Deputy Director of DC Health's HIV/AIDS, Hepatitis, STD, and TB Administration, affectionately known as HOSTA, to provide a more detailed overview of the 2022 Surveillance and Epidemiology Report data. She will also share information about the DCN's HIV plan and discuss critical DC Health resources, such as the PrEP housing program. And now I would like to ask Mr. Phillips to come forward. Thank you.
Thank you, Dr. Lewis. Good morning, everyone. And thank you. And on behalf of the White House, I'm honored to be here with you on National Black HIV/AIDS Awareness Day, a day when we call attention to the disproportionate impact that HIV has on the Black community. Thanks to the DC Health Department staff and SMILE and their partners all across DC who are doing exactly what is asked of them through the National HIV/AIDS Strategy and the Ending the HIV Epidemic Initiative in the United States. They are accelerating the efforts, listening to the community about what's needed, and finding ways to implement innovative programs on the ground. I'd also like to thank others from the Biden administration, some of whom are here, including our staff from the Monkeypox Coordination Team, Housing and Urban Development, CDC, and HHS's Office of Infectious Disease and HIV/AIDS Policy. Our colleagues across federal agencies have pushed their programs further, collaborating across agencies to ensure partners on the ground can create new programs and be more responsive to those who need them. A specific example of innovative programming is the recently released I Am a Work of Art campaign, developed in partnership with creative partners at the community level to encourage people with HIV to get into care and achieve viral suppression. We know that with the HIV epidemic, we have come so far, and yet all of us here are acutely aware that we must do more to realize the end of new HIV infections, particularly in our most affected communities, like the Black community. That's why I'm so excited to be here showcasing such exciting and groundbreaking programs created through the Department of Health, DC Department of Health, their programs, and their community partners. One such example is the Ron Simmons Wellness Program that we'll see later today that helps us address stressors that were created to help address holistic health and wellness. And we know the COVID-19 pandemic exacerbated many challenges and stressors in our community, particularly among Black men and women, where we were already experiencing such difficulties. The health department listened to what the community was saying and put in place new services to increase readiness to access to HIV care and prevention services. A holistic approach that embodies the spirits and the actions of what Dr. Ron Simmons said, did, and taught us during his time with us. Early on in the HIV epidemic, he created programs to respond to community needs, particularly the Black community. He worked to build self-esteem, resilience, and empowerment. And I am so excited to see this legacy continue in his name. And before we move on to the next speaker, I really want to congratulate all of DC for moving from a high incidence jurisdiction for HIV infections to a moderate incidence jurisdiction. This is a testament to the challenging work the health department and their partners have done to partner with the community and put in place new and innovative programs. Thank you.
So thank you for those words, Director Phillips. Really hard act to follow, but I'll first say thank you, DC. Thank you, Dr. Lewis. Thank you, Director Barnes, for inviting us on such an important and auspicious Awareness Day as National Black HIV/AIDS Awareness Day. So really important. I think a lot of what you've heard from folks already will just also resonate in what I have to say. And I will just start by saying HIV does not live in isolation. It's a part of a complex system of interacting epidemics that are made worse by social factors that impact health. We call that complex system a syndemic. People do not ever just face one health challenge, especially people whose health is further impacted by biases like racism, homophobia, transphobia, and the many other phobias and isms that hinder access and success in health. You cannot prevent HIV without attention to the social factors that facilitate its transmission. That's why this program in DC is so important. And we are proud to be partners with DC in ending the HIV epidemic. Important funding that supports some of the work that happens here, and specifically the work around the PrEP housing that we're going to see later on today. Housing is healthcare. You're going to hear that from Ms. Herker later. It prevents HIV and prevents worse outcomes of HIV in those living with the virus. Housing people on PrEP provides us the opportunity to address a key social factor that we know drives HIV infection, especially among young LGBTQAI+ and two-spirited people of color. Being housed means that you have the oxygen that you need so that you can care more about your health, to care about HIV, and to connect with interventions such as PrEP that we know work. Not having to couch surf or exchange yourself for a safe space to sleep means that you can go on PrEP and stay on PrEP. And we know that PrEP works. It prevents HIV unless circumstances like not knowing where you're going to sleep disallow you from getting and staying on the medications and just getting the care that you need. On this auspicious day, National Black HIV/AIDS Awareness Day, this message resonates. HIV disproportionately affects Black people who are underrepresented among PrEP users in the U.S. and overrepresented among new HIV diagnoses. The data that you're going to hear from Clover is so important. The data is power. It shines a light on the disparities. So I'm very excited that we're going to hear more about this amazing report, and thanks to Mayor Bowser for being so supportive. We also know that HIV risk and outcomes are made worse by unstable housing or homelessness. The more we support people to live safely and focus on the quality of their lives, the more we can address the inequities that we see across all HIV prevention. I have one really inspiring thing to remind you, which is that we can interrupt the syndemic cycle with strategies that provide holistic services that blend HIV prevention into the core life services that people need to stay healthy and, yes, happy, and allows them the space, and again, that oxygen, to consider the wealth of HIV prevention services that may fit their lives, including PrEP and PEP, HIV treatment, and condoms. So I'm excited to see DC grow and prosper. I'm excited to see this program grow that demonstrates an important lesson. Interacting epidemics or syndemics, those problems require syndemic solutions. It's never just HIV. So we should use strategies inspired by DC, like this one, that address not only the virus, but the lives, the needs, and the wants of people who are affected by HIV. I'm going to give the floor over to Rita now.
Wow, thanks for that. I'm Rita Harker. I'm the director of the Office of HIV/AIDS Housing at HUD, and I feel like Dr. Daskalakis has made the case for housing, so some of what I say will just echo that. And also want to express my gratitude for the invitation to be here today to represent HUD, and I'm so excited to see and learn more about the progress that's happening here. It's very inspiring for us at the federal level. I want to talk a little about the HOPWA program. The Housing Opportunities for Persons with AIDS program is HUD's dedicated program for people with HIV. And under HOPWA, HUD makes grants to eligible cities, states, and nonprofit organizations to provide a range of eligible rental assistance, housing development, and homelessness prevention activities, as well as supportive services, specifically for low-income people with HIV. In October, the HOPWA program entered its 30th year of being funded. And this is a reminder that we've all been hard at work for a very long time to end the HIV epidemic. The HOPWA program was created before there was life-saving medication that we have today. So at that time, it was really a program to provide people with AIDS a place to die with dignity. And now, with the advancements in HIV care and treatment, the purpose of the Office of HIV/AIDS Housing and the HOPWA program is to utilize housing as a structural intervention in ending the HIV epidemic. Part of the recognition of this milestone includes the Reset, Renew, Recharge, or the 3R initiative, where the HUD Office of HIV/AIDS Housing has created forward-looking blueprints for advancing program design and core values that will positively impact the lives and housing stability of people with HIV. The 3R initiative looks to advance the good work being done both federally and in communities across the nation, including the important work being done here in D.C. As mentioned, HOPWA is a housing program, so why are we talking about housing when discussing ending the HIV epidemic? Well, as Dr. Daskalakis and Director Phillips have said, there's a large body of research on the impact of safe and stable housing on HIV care and prevention outcomes. We know that housing provides a foundation from which people living with HIV can access care and treatment, achieve sustained viral suppression, and live long and healthy lives. We know that safe, stable housing enables people to prioritize their own health, participate in HIV prevention, and reduce behaviors associated with HIV. At HUD, we believe that we cannot end the HIV epidemic without addressing homelessness and housing instability for the populations most impacted by the HIV epidemic. Through the federal implementation plan for the National HIV/AIDS Strategy, HUD as an agency has committed to actions that include distributing HIV prevention information to residents in all HUD-assisted housing, identifying and disseminating best practices, and expanding local coordination in HIV clusters and outbreaks, where homelessness or unstable housing have been identified as the compounding factors. Ensuring racial and LGBTQI+ equity and access to HOPWA housing and services, and increasing the level of engagement and program planning among the people with lived experience of HIV homelessness and housing instability. One way the HOPWA program is aligning funding to end the HIV epidemic is through the Housing as an Intervention to Fight AIDS, or the HEFA grants, that awarded over $40 million to 20 communities in December of 2021. The purpose of those grants is to provide communities with opportunities to create and implement new projects that align with local and national initiatives to end the HIV epidemic. At HUD, we see the important work being done in communities such as D.C. to end the HIV epidemic, and we applaud D.C. for reaching the next phase in the local plan to end their HIV epidemic. We look forward to continuing to be a partner through HOPWA funding and other HUD programs as we continue to elevate housing as an effective and structural intervention in ending the HIV epidemic. Thank you all for the hard work that you're doing to meet the housing needs of people with HIV and their families here in the district.
Well, good morning. It's a hard act to follow behind all these smart and wonderful people up here. But I'm Clover Barnes. I'm the Senior Deputy Director of HOSTA, that was affectionately spelled out earlier. And we released our annual report today, and it shows that there are 11,904 people living with HIV in the district. Of those, 71% are Black. On this Black HIV Awareness Day, we need to bring awareness to the disparities that are still existing in our epidemic today. 230 new infections of HIV were found in D.C. in 2021, which is up slightly from 2020, but still down from 2019. We do expect for those numbers to continue to increase because of the changes in healthcare seeking behavior from COVID. A lot of preventative appointments and wellness visits haven't been done because of all the capacity changes and closing that happened during the pandemic. And so we are not surprised to see that slight increase. As care-seeking behaviors return to normal, we do expect to see more increases in HIV as more people get tested and return to their normal care-seeking behavior. Of those new infections, those 230, they were largely men and largely black. That means we still have work to do. Programs like our HIV housing, our Ending the Epidemic Plan programs, our Ron Simmons Wellness Program, are all tools that we're using to try to combat those figures. Recently, DC Health and HOSTA went through some changes in how we operationalize our work. We moved our prevention team to a syndemic approach, as Dr. Daskalakis just spoke about, working to end epidemics and do prevention and harm reduction in a coordinated way across the different diseases that impact our communities. We also have implemented several status-neutral approaches, meaning that there's no wrong door for people to come in to get services. That whether you're there for prevention or care, there's less stigma, there's less barriers, and there's less resistance to what you're going to meet when you get there. That way, whether you're coming for a test or you're coming for treatment, you can come to the same people who you build a rapport with and find connection with in the community. We have several locations within the district that are eligible and allowable for people to receive free care. We're working to improve our PrEP uptake, and that's part of the reason we have one of these housing programs. Our PrEP and housing is a pilot, and we're very hopeful in what we've seen in this first year of its implementation, in hopes that we can continue to evolve that program forward. Among the people who were diagnosed with HIV, our viral suppression rate was about 66% for the district. That needs to increase. We know that programs work. Our Ryan White program has a viral suppression rate of 88%. We know that we need to connect more people to care and that we need to get them into those programs that we have proven have worked through funding through our federal partners and partnerships with our community partners. This is what we will continue to work on in our Ending the HIV Epidemic Plan, and we are hopeful of where we're going, and we know that our community partners and the community engagement that we conduct will help us get there. Thank you.
Thank you, Clover. On behalf of Mayor Muriel Bowser, I would like to thank you for joining us today and partnering with us in the fight to end HIV epidemic. We will now be open to questions from the floor and the press.
I have a question.
Sure.
And this is, I guess this is for you.
Yes.
Sorry,
Yes.
So the pre-pandemic, the AIDS rate in DC was down. Is that correct?
In 2019, the new infections were about 270, which is still higher, still lower now, but we do expect it to come back to close to that level.
So it did not increase during the...
No, it did not. But we also know the caveat to that is we had significantly less HIV tests done during the pandemic, right? So we expect to see less because we had thousands of less tests than what we normally would have had because of the pandemic. A lot of entities were closed. There weren't a lot of people who were seeing patients for preventative care, only for emergencies when the pandemic was at its highest, when the city was shut down and that sort of thing. So we expect now that people are opening back up and they're building back their capacity that we will continue to see slight increases in the next year or so as people return to their care-seeking behavior.
Now, are all the, most of the care centers fully operational and back open?
They're all open. They're building their capacity. We all know the Great Resignation has been real, and so hiring people has been a stumbling block for some people, or a barrier, but everybody's working diligently. The funding is there to support those people, and so all of the entities are working to hire and get their capacity full at this point. Mm-hmm.
Questions also for Deputy Director Barnes. Can you explain what it means to move from a high incidence jurisdiction to a medium incidence jurisdiction? And if that's purely statistical, if there's more that goes into that than just the numbers.
Yep, I might call on Dimitri to help me with this one a little bit, Dr. Daskalakis, but it is, it means the high incidence jurisdictions are the ones with the highest burden of HIV around the country. So you have the highest rates of anybody. When you move to a moderate, that means that you have decreased your HIV burden to a certain point, and I'm sorry I don't have those statistics in front of me of what varies the difference, but it means that we have done a good job at decreasing the amount of HIV infections in the district. It also means that we need to continue what we're doing as a foundation and then build on top of that and have innovative programs that work to reach the people who haven't been reached yet and who are still acquiring HIV.
And just following up to that, that's new this year, that move, and do other, is that a trend for other cities around the country as well?
I wouldn't say it's a trend around the country. I think we're an anomaly in that point at this point. I know Baltimore City saw some reductions, but beyond that, I don't know of any other jurisdiction that has moved from high incidence to moderate incidence.
Okay, thank you.
They say I'm right. All right, thank you.